How did historical pathology breakthroughs transform medicine? Imagine trying to fix a car without knowing what's wrong. That's what medicine was like before pathology made big discoveries. Pathology is the study of disease processes, including what causes diseases, how they develop, and what effects they have on the body. In medical school, especially during the first and second years, students learn that understanding these concepts is key to diagnosing and treating patients. In the early days, doctors relied on simple observations and autopsies to figure out what was wrong. They looked at organs and tissues after death, trying to find clues. But everything changed when microscopes were invented. Suddenly, doctors could see tiny changes in tissues and cells that were invisible to the naked. This led to identifying diseases like tuberculosis and different types of cancer more accurately. It was a huge step because it meant diagnoses could be based on actual tissue changes, not just symptoms. Another major shift came with the discovery of antibodies. These are proteins our immune system makes to fight off bacteria and viruses. Scientists learned to use antibodies to find specific proteins in tissues. This technique, called immunohistochemistry, helps pathologists tell different diseases apart, especially different kinds of cancer. Knowing exactly what type of cancer a patient has helps doctors choose the best treatment and predict how the disease might behave. The invention of the polymerase chain reaction, or PCR, was another game changer. PCR makes millions of copies of a small piece of DNA. This allows scientists to study genetic mutations even in tiny tissue samples. Medical students learn that PCR is used to find genetic changes linked to inherited diseases, infections, or cancers. This has led to personalized medicine, where treatments are tailored to each patient's unique genetic makeup. Studying chromosomes also changed pathology. By looking at chromosomes, scientists found that some cancers are caused by specific genetic changes, like parts of DNA swapping places between chromosomes. This helps pathologists diagnose cancer more precisely and decide on the best treatment options. All these advances have practical effects in medical school and real-world practice. Students learn to interpret pathology reports that use these techniques to identify diseases. They see how pathology guides treatment plans, like choosing specific chemotherapy drugs based on genetic information. Overall, these breakthroughs made medicine more precise and effective. Instead of just treating symptoms, doctors can now target the root causes of disease. This has improved patient outcomes and changed how medicine is taught and practiced. Understanding these historical moments helps students see how far medicine has come and why pathology is so important in the journey of healing.